Welcome all. I really appreciate your tremendous response. And let's get into the answering the question that I've uploaded. The topic was depression. And let's start the proceeding with the blessing of Swami Vivekananda. The first question, that is a pictorial question, and this is a very interesting question because there are two parts of this particular question. You have to actually, it's an integrated question. And this sort of questions is very commonly asked in AIMS and also in the NEET examinations. So here the different parts of the brain are actually numbered, and on the right hand side the thing that have been stated out here, the MRI studies have shown the reduced volume of certain areas, the gray matters, in major depressive disorder. So you have to understand the question is actually asking you which areas of the brain is actually have the reduced volume. So you have to first pinpoint the locations. Here so one is actually pointing towards hippocampus. One is actually pointing towards here hippocampus. Two is actually pointing towards amygdala. Whereas 3 is actually pointing frontal lobe. The confusion actually erupts between 4 and 5. 5 is thalamus and 4 is hypothalamus. 5 is actually thalamus, pointing towards thalamus, and 4 is hypothalamus. So right now we have to actually understand the question is asking MRI studies is actually showing the reduced volume of gray matter in which areas of the brain, and that is the answer. Now is going to be very simpler. If you can figure it out, it is amygdala and hippocampus. So the answer will be 1 and 2, amygdala and hippocampus. The next question is also very interesting one. This is actually a very new question, and this sort of question can be easily be asked in NIMHANS and also in the JIPMER examination in particular. Beck Depression Inventory by Aaron T. Beck is most widely used psychometric test. Have how many MCQ? So it's a psychometric test. There are number of MCQ are going to be put there, and for each MCQ there is some marks is there. There are categorical marks is there. So Beck Depression Inventory actually differentiate the type of depression in patients. So before going into BDI, right now we have not only BDI 1 but we have BDI 2, and remember this is from DSM 4. Right now we have DSM 5, so it is actually from DSM 4. It have been given there first time. Right now we have BDI 2. Now each and every questions are marked like 0, 1, 2 and 3. So altogether there are maximum 21 questions, and patient actually fills it up themselves. Actually the scores have been divided into 4 strata. One is 0 to 13. Then there will be 14 to 19. 20 to 28, and then after 29 to 63. So the four categories are minimum, mild, moderate, and severe. Actually, if all the questions have 3, the maximum answer is going to be 63. So 21 questions are there, and it is filled by the patient itself. Now the third question. Here this is actually Ames ascending and descending pattern kind of question. Here the side effect of a SSRI, fluoxetine, this is a prototype drug, and which is given to the depressive patient, is given. So it is actually have to categorize from most common to least common. The most common side effect of fluoxetine is nausea. Then after going to be anxiety, then after diarrhea, and lastly there will be inhibition of ejaculation. So the answer of this most common to least common is 1, 2, 3, 4. This kind of question is actually can come up in like Ames ascending and descending pattern question. Now going to the next question, and this is an image based question, and here two important signs are there. One, you can see out here, this is omega sign, and on the left hand side there is a triangular fold in the upper lateral part of the leaf. This is known as Otto-Varagat sign. Otto-Varagat sign. This is omega sign. It is seen both of them seen in chronic depression, melancholic depression. I'm going to the last question. Dysthymia in an adolescent can be termed if depressed mood persists for at least. So we know dysthymia where the depressed mood should persist for 2 years. 2 years. But that is in cases of adult. In cases of infant, child and adolescent, even if 1 year depressed mood is there, that is known as which is not qualified fulfilling all the criteria of the major depressive disorder, that is actually termed as dysthymia in cases of child, infant and adolescent. Hope you like this answering, and if you have any suggestion, please put it on in our Facebook pages message boxes. We really appreciate your suggestion and support. All the likes and all the messages are very precious to us, and we according to your feedback, as you have said, you are really tired after your last examination, so we have decided we are not going to upload the Tbqa next topic based question answer discussion in the upcoming months. We most probably going to upload the next in the month of May or June. We really value your support. We got support from not only India but abroad too, and we really value it. All the messages, all your suggestions, we take it very seriously. And you can join us in both Facebook and YouTube. There is 250 plus videos are uploaded out there. You can jolly well check them. You can ascertain the quality yourself. And regarding our live lectures, we'll let you know once we are finalized. We are talking with you for both online and offline lectures, and we'll let you know. Thank you.